Hey guys, Dr. Tripp coming at you from our new whiteboard, where today is going to be one of the first meetings of hopefully many more to come down the road, talking about various different health conditions and happenings at the office and all kinds of fun stuff. So leave comments if you like. Let us know what you like. Let us know what you don't like. And also let us know if there's anything you'd like to know more about. Maybe it'll show up on the whiteboard. But today we want to talk about plantar fasciitis. It's a malady that affects over 1 million people in the United States annually. It's a lot of folks, and here in our office we got a lot of folks that suffer from it as well. So we've been very successful in our protocol of taking care of plantar fasciitis and wanted to share some of that with you today. So what is it? It's a fibrous tissue inflammation of the plantar fascia that's underneath the foot. What can happen is it develops micro tears in that fascia, and that can lead to what you feel as the pain. One of the hallmark signs you'll see is that it's usually worse first thing in the morning. You'll get out of bed, you'll start walking around, the feet really hurt. Then the pain will kind of ease off. Sometimes it goes away, sometimes it doesn't, but it's typically worse first thing in the morning. That's one of the hallmark signs that you know you may be suffering from plantar fasciitis. Some of the causes, we could look at excessive load or stress. If we're putting too much pressure on our feet with what we're doing and the feet maybe aren't supported properly, it's going to load and stress that plantar fascia, which can lead to that fibrous tears and the inflammation that we were talking about a second ago. Any kind of high intensity workouts or exercises, talking about long distance running or ballistic jumping or anything that's really putting a lot of stress and load on the foot as you try to go through an athletic type movement. Tight calf muscles or tight Achilles tendon, that can affect how the foot's moving, and that could lead to excessive wear and tear and excessive stress onto that plantar fascia. And then also people that suffer from either flat feet or those that have very high arches. Anytime there's a change in normal biomechanics of the foot, it's going to start to put some pressure on that plantar fascia. Okay, now some of the treatment options that we have in our office, we're looking at rest is one of the most important things. You can kind of take some of that load and stress off, give the foot a chance to kind of rest and recover. Then we talk about doing some ice for about 15 minutes with a frozen bottle of water. You simply roll the frozen bottle of water under your foot for about 15 minutes or so. It gives a nice ice massage. It works very nicely. The other thing we want to look at is strengthening, and one of the things you can do is you can simply throw a hand towel down on the ground, start to grab it with your toes like you're kind of gather it up. That'll actually help get the muscles to fire and get them to work more effectively and help and support that plantar stress. There's various types of taping out there. We can look at some kinesio taping or even some of the traditional white athletic tape that we can actually take some of the stress off of that plantar fascia. One of the things that's been very successful in our office is the use of our custom-made orthotics. Anytime that we can get the proper support underneath the foot, then we're going to help alleviate a lot of that stress and that load that's being put onto the plantar fascia. But our ace in the hole is our FX635 laser. This is actually the only laser that's been cleared for the treatment of plantar fasciitis by the FDA. So we actually can tell that it will function and work well to take care of your plantar fasciitis. The way it works is something called photobiomodulation. And basically what that is a photon of energy will be absorbed from the laser into the tissue. That tissue then starts to make more energy. In addition to that, it actually increases blood flow. So you're getting increased blood flow, increased energy production, which all leads to decrease in inflammation and the promotion of healing. Extremely effective and extremely important when we're trying to deal with something like plantar fasciitis. And again, it's the only laser that's been cleared by the FDA for the treatment of plantar fasciitis, so that's very nice. In 2014, in June, the journal The Foot and Ankle International published a study that took 30 subjects on a pain scale of 0 to 100 that started at about an average of 68. At a 12-month follow-up, these subjects reported a pain scale of 6 on that scale of 100. So to me, that's huge. We're talking now, instead of taking care of pain, we're talking about taking care of the function. We're getting things to work better, and we're getting down to the root cause of the problem. So if you guys have any questions about plantar fasciitis, feel free to leave a comment or call the office and see if we can help you with something. We'll be happy to help you. You guys take care now.